let's take a look at this, right, in terms of blood pressure. In terms of blood pressure, how do we know these sounds? What do these sounds represent? So let's think about what's occurring here, right? Let's say my blood pressure is normal, 120/60. Every year it keeps getting lower, like I said, right? So let's say my blood pressure is perfectly normal, 120/70 or 120/60. What does that mean? That means when I put the cuff on my arm right here, there's no pressure in the cuff, blood is free to move around, right? Now, as I start inflating the cuff, it goes to 100. Well, at 100 millimeters of mercury in the cuff, I still have more pressure in the blood vessel than in the cuff. 120 versus 100. I have normal blood flow at that point. All right? Now, as I get to about 120, right, what happens? The pressure in the cuff is equal to the pressure in my artery, and I'm starting to close that artery down. As I start closing that artery down, I should start hearing a sound. The weird thing is this: I should never hear a sound when your artery is completely open. So if I put a stethoscope right into your brachial artery right now, I should hear nothing. That is true for all your arteries. If I put a stethoscope right into your carotid artery, as long as fully open, I should hear nothing. Right? So in the absence of any constriction, you have normal flow in a fully, dilated vessel, you shouldn't hear sound. Now that I have actually, kind of the cuff pressure exceeds the pressure in my arteries, what happens? Now I'm at, like, usually, you go to about 160, right? You pump it up. By the way, don't go beyond 160 unless they tell you, because I see that sometimes, and people go way up to 180, and then the person that they're, measuring kind of is looking at them, they're kind of turning red, especially as they're slowly decreasing the pressure in the cuff, right? So we go to about 160, and then at 160, there's a lot more pressure in the cuff than in my artery, the brachial artery. And I slowly release that pressure. 160 to 140, still more pressure in the cuff than in the artery. No blood flow, so you shouldn't hear anything, right? At 120, still a little bit more, equal pressure. At 119, 118, now the pressure in the cuff is slightly less than the pressure in my brachial artery. I will have some resumption of flow, but the flow will be constricted because there's so much pressure in the artery that I'm constricting that brachial artery a little bit. So I start hearing sounds. Remember, when there's completely open vessel, no sound. Now there's a constricted vessel, but now there's a little bit of blood moving. As there's a little bit of blood flow moving, well, we know there's normal resumption, but still the vessel's constricted, right? That's our systolic blood pressure. As we go lower, right, you're still constricting the artery. At 110, what happens? I can still hear something. Why? Because the vessel is still constricted slightly. At 100, still constricted, I still hear those crackle sounds. Remember, my diastolic is 70. So what happens? At 70 millimeters of pressure in the cuff, right? Now it's equal. In my artery is at 70, in the cuff is at 70. At that time, there's equal pressure in both regions. Now there's not enough pressure to even constrict the vessel. The vessel at that point is completely open. And what did we say about when you have completely open vessel? You shouldn't hear any sounds. So when my diastolic blood pressure at 70 equals a cuff pressure at 70, you're no longer constricting the brachial artery. There's no constriction at all. That's why you hear an absence of sound, right? That's why the absence of sound is your diastolic blood pressure, is because it is that kind of, pressure where it is a pressure. I'm trying not to give the answer away, that's fine. All right, it is a pressure where there is normal resumption of blood flow. But that's about as general as I can give it, but without giving you the answer that I want to get.
I know it.
All right, write it down, don't tell me. All right, now, normal flow is called laminar flow, and that's the kind of flow we want. Laminar flow means it's a fast flow where the fully patent brachial artery achieves laminar flow, and now is silent. In order to have laminar flow, and here's laminar flow right here, that's the fastest, lowest pressure flow. Right? In order for that to happen, the blood vessel has to be fully open. Now, why we hear those Karatkav sounds is because until we have laminar flow, we'll have turbulent flow in an intermediate time period. So once you open the blood vessel, right? So at 120, the blood vessel starts to open. Well, the blood vessel opens, but it's severely constricted at that point. Because it's constricted, you have turbulent flow. The sounds that we hear, those Karatkav sounds, are due to turbulence, and it is not normal. In other words, if I put a stethoscope onto, hopefully not yours, but, well, hopefully not your parents either, but some older stranger's neck, right? And you're probably wondering why in the world I'm putting a stethoscope in a stranger's neck, right? But if I was testing them, if I would put my stethoscope next to the carotid artery, somebody older, they might have a little bit of a sound that I could hear. That's a bad sign, right? That's a bad sign because now there's some kind of constriction there. And usually that's a precursor for having a stroke, is that you have some kind of blockage and that causes the sound to be appearing. In a fully open vessel, it should be completely open and I should not hear anything. So it's a good thing when a doctor goes to your parents, right? Listens to the heart, he listens to the neck region and doesn't hear anything, right? That is something we want. Right, now, blood flow and what is it proportional to? This is where I will kind of use this right here. In terms of blood flow, this is that factor that we're going to talk about.